Employees eligible for medical benefits have 3 Kaiser Permanente plan enrollment options with no pre-existing condition limitations. Kaiser Permanente members have 24/7 access to My Health Manager, a secure member online portal allowing you to email your primary or specialty care physician, pharmacist, or other Kaiser providers you've seen for care, order prescription refills, view most lab test results, schedule, view, or cancel routine appointments, view recent office visits, and more. For a preview of the Kaiser online portal, go to www.kp.org/experience. We will start by discussing the district's base plan, the Kaiser High Deductible HSA Compatible Health Plan. Kaiser Permanente High Deductible HSA Compatible Health Plan members will pay the full cost of Kaiser medical services, prescription drugs, and hospital services until the annual $5,000 individual deductible or $10,000 family embedded deductible has been met. Once the annual deductible has been met, all Kaiser covered medical services and covered prescription drugs are paid 100% by Kaiser. Annual maximum out-of-pocket is $5,000 for individuals and $10,000 for family. Due to Affordable Care Act mandates, high deductible health plan deductibles for families changed effective July 1, 2016 from aggregated deductibles to embedded deductibles. An embedded deductible means that when one family member reaches the individual $5,000 annual deductible, that family member has met their annual deductible, and future eligible claims above $5,000 will be covered at 100%. The other family member's claims will be applied to the remaining $5,000 annual family deductible. This is an improvement in benefits for families. Employees enrolled on this high deductible health plan may be eligible for a health savings account, which will be called an HSA, into which School District 27J will deposit money into the HSA for employees to use to help pay for plan deductible. District 27J will deposit $250 per month, which equals $3,000 annually for individuals, and $500 per month, which equals $6,000 annually for families, into an employee's HSA. This means that once the cost of covered medical expenses exceeds the amount deposited into the HSA in a plan year, the maximum annual out-of-pocket cost of the high deductible health plan is limited to $2,000 for individuals and $4,000 for families. Employees can voluntarily contribute personal funds into their HSA. Per IRS rules, the 2017 annual HSA contribution limit is $3,400 for individuals and $6,750 for families. This IRS HSA limit includes both employer and employee contributions. Individuals aged 55 and over may contribute an additional $1,000 into their health savings account. Money in an HSA rolls over year to year and can grow to an unlimited amount. Employees keep the money in their HSA even if they leave employment with District 27J. Health savings accounts will be discussed in more detail in another presentation. Another medical plan offered by School District 27J is the Kaiser Deductible HMO, which will be referred to as the DHMO Health Plan. Effective June 30, 2017, DHMO plan members will begin paying a $72 per month co-share of premiums for employee-only coverage. Kaiser DHMO members will pay a co-payment for doctor office visits and prescriptions. These co-pays are $20 for a primary care office visit and $40 for a specialist visit. If you have a procedure as part of the office visit, such as removal of a mole, stitches, etc., these services are subject to the annual deductible and coinsurance. In addition, DHMO plan members will pay co-payments for most prescription drugs, which are $10 for generic medications, $20 for brand name medications for a 30-day supply, specialty drug costs 20% up to $250 per fill, such as self-injectable drugs, excluding insulin. Members who take maintenance medications can also use the mail order services to receive up to a 90-day supply for most medications at cost of only 2-month copayments. The annual DHMO plan deductibles are $2,500 for individuals and $5,000 for families. After the annual deductible is met, Kaiser DHMO members will pay 20% coinsurance until an additional $2,000 for individual and an additional $4,000 for family is met. Therefore, the annual out-of-pocket maximum is $4,500 for individual and $9,000 for families. Once the annual out-of-pocket maximum is reached, copays will no longer be required for office visits or prescriptions. Per IRS rules, employees enrolled on this plan are not eligible for a health savings account. The third medical plan offered by School District 27J is a Kaiser Added Choice Deductible Coinsurance Plan, which will be referred to as ACDC plan. ACDC plan members are allowed to seek medical services in 3 different provider networks. 1 through the Kaiser Permanente network for the lowest out-of-pocket cost, 2 through the Private Healthcare System PHCS network for a higher out-of-pocket cost, or 3 with any medical provider for the highest out-of-pocket cost. The monthly premium is much higher due to the option of receiving medical services outside the Kaiser network. Effective June 30th, 2017, the employee co-share of the employee-only premium will increase to $144.72 per month. Per IRS rules, employees enrolled on the ACDC plan are not eligible for a health savings account. The ACDC plan out-of-pocket costs will vary based on the provider network where services are received. As you will see on the presentation, we will outline the benefits of each network referred to as Tier 1, 2, and 3 offered with the ACDC plan. Tier 1 is the Kaiser network, giving you the lowest out-of-pocket cost. Annual deductible, $2,500 for individuals and $5,000 for families. Annual out-of-pocket maximum, $3,000 for individual, $6,000 for families. Office visit copays, $25 primary care, and $40 for specialists. Prescription copay, $25 generic, $40 brand name, 50% specialty. Coinsurance, amount member pays once the deductible is met. Member pays 20% and Kaiser pays 80%. Tier 2 is a private healthcare system, PHCS network, giving you a higher out-of-pocket cost. Annual deductible, $3,000 for individual, $6,000 for families. Annual out-of-pocket maximum, $3,500 for individuals and $7,000 for families. Office visit copays, $35 primary care, $50 for specialist. Prescription copays, $30 generic, $50 brand name, 50% specialty. Coinsurance, amount member pays once the deductible is met. Member pays 30% and Kaiser pays 70%. Tier 3, any out-of-pocket network provider giving you the highest out-of-pocket cost. Annual deductible, $5,000 for individuals and $15,000 for families. Annual out-of-pocket maximum, $8,000 for individuals and $24,000 for families. Office visit, 40% coinsurance. Prescriptions, 50% coinsurance. Coinsurance, amount member pays once the deductible is met. Member pays 40% and Kaiser pays 60%.